Despite the overall progress made in vaccinating residents for COVID-19, vast gulfs in inoculation rates have opened among California's 58 counties, illustrating the state's uneven pace toward community immunity against the coronavirus. On one end of the spectrum are the counties of Marin, Alpine, San Francisco, San Mateo, Santa Clara and San Diego, where more than 65% of each area's residents have received at least one vaccine dose, according to data compiled by The Times. On the other are Lassen, Tehama, Kings, Modoc and Yuba counties, where fewer than one-third of residents are even partially vaccinated. Overall, more than 36 million doses have been doled out statewide, and 53.4% of Californians have gotten at least one shot to date. Officials have long preached that widespread inoculation is essential to stop COVID-19 and ensure that additional activities and more robust business operations can resume without triggering a wave of new infections. Our economy is more open, and we are interacting more with each other than we were when we entered our third surge this past winter, Dr. Grant Colfax, director of the San Francisco Department of Public Health, said in a recent statement. But instead of surging again and going into another lockdown, our case rates and hospitalizations continue to fall. That is the power of the vaccines at work in our city. Estimates vary on how many residents will need to be vaccinated to reach longer-lasting herd immunity, the point at which enough people have been inoculated to protect the larger population against the virus. That threshold is usually pegged at 80% or higher. And while a generally high statewide level of vaccination may be enough to ward off another devastating surge, the concern is that the coronavirus could still flare up in areas where coverage is low. As of Wednesday, 16 California counties had yet to report 40% of their residents receiving at least one vaccine dose, the Times data show. It is important to note, though, that not everyone is eligible to roll up their sleeves yet. Two of the vaccines available in the United States, the single shot from Johnson Johnson and Moderna's two-dose regimen, are eligible only for use in adults. The Pfizer-BioNTech vaccine, which also requires two shots, can be used in children as young as 12. There are a host of reasons why vaccine coverage could vary so widely. For starters, there are practical issues related to access. It may be harder for those living in rural or more far-flung areas to find convenient vaccination options. Other residents may be too slammed with work or their responsibilities at home to carve out time to visit a site, or face language or technological barriers that make it difficult to figure out how or where to get vaccinated. There is also a segment of the population that is generally hesitant toward or adamantly opposed to the vaccines.